Hello everyone, welcome back. My name is Kweku. I am a pharmacist. Today I'm going to be reviewing the medication nifedipine. We will take a look at its description and uses. We would also look at some side effects, some precautions, and some best practices as well. Brief disclaimer before we proceed that this video is for informational purposes only and is not intended to be a substitute for medical advice from your physician. So what is nifedipine? Nifedipine belongs to a class of medications called calcium channel blockers. And as the name implies, they achieve their effect by blocking calcium ions from entering into the cells of the heart and the arteries. Now, calcium is required for the contraction of every muscle. However, for people with high blood pressure and certain heart disease, calcium may cause the heart and the arteries to contract more strongly. And therefore, by blocking the channels through which calcium enters these muscles, the muscles relax, in which case causing a dilation or expansion of the blood vessels, reducing the workload on the heart, as well as a reduced resistance to blood flow, and ultimately leading to a lowering of the blood pressure. With respect to uses, there are several non-FDA labeled uses or off-label uses, but the two main FDA approved uses are for hypertension and angina, both stable and variant angina, which basically is chest pain. When it comes to side effects, the most common one is headache. Headache is arguably the number one reason why a lot of people are not able to tolerate nifedipine and may have to discontinue the medication. With that said, there are also lots of stories where people had an initial headache, but with time, their body and their systems got used to it and they were able to continue the medication. So work with your doctor. If it's something that you can, not too bad and you can tolerate it for a couple of days, chances are that it may subside, especially if your doctor thinks that nifedipine is the best medication for your particular circumstance. Another commonly reported side effect is peripheral edema, which is manifested in the swelling of the legs and the ankles. Basically, there's fluid retention in those areas. Peripheral edema is typically dose dependent. That means that the higher your dose, the greater the risks of developing peripheral edema. In one study, it occurred in about 4% of the people that took it at doses less than 60 milligrams, and 12.5% at doses greater or equal to 120 milligrams per day. And this further increased to about 30% when the people or the patients took 180 milligrams per day. So you see a direct correlation between the dose and the incidence of peripheral edema. So a lot of the times, if that occurs, one of the considerations your doctor may think about will be to reduce your dose to see if that resolves. Dizziness or lightheadedness is also another reported side effect, and this may be due to hypotension where your blood pressure is actually going too low. There's also been reports of weakness, fatigue, flushing, palpitations, and nausea in some instances. Other less common side effects reported include insomnia, sleep disturbances, confusion, drowsiness, shakiness, jitteriness, and sometimes even difficulties in balancing or paranoia have all been reported. But you can see from the percentages that these are relatively rare. They don't occur as frequently as something like, say, the headache or the peripheral edema. When it comes to precautions and best practices, the first one I want to mention is to avoid grapefruit juice before and during the use of nifedipine and other calcium channel blockers for that matter. Grapefruit juice is known to cause an increase in the concentration of nifedipine in the system, and this may be detrimental. As a matter of fact, the manufacturer of one of the brands of nifedipine, Adalat CC, recommends stopping grapefruit juice for 3 days prior to initiating nifedipine therapy. Caution should also be exercised when nifedipine is used in the elderly. This is because it can potentially cause hypotension where the blood pressure dips too low. This is especially true if the immediate release tablets or capsules are used, and also at the start of taking the medication. So if this is the first time you're taking it, or when the dose is increased. So all these are instances where caution should be exercised to make sure that the blood pressure is not going too low. Another phenomenon that one needs to be cautious about is orthostatic hypotension. Now, orthostatic hypotension is when your blood pressure goes suddenly low when you go from a sitting or a lying position to a standing position. And this can cause falling or fainting in some situations. So it's generally recommended that if you're on nifedipine, when you're rising from a sitting or a lying position, do it gradually. Let your body get time to adjust. Otherwise, if you suffer from orthostatic hypotension, it may lead to falls in some cases. Also, we talked about the side effects, palpitations and peripheral edema. Do well to report these to your doctor, as whilst they may not be anything serious, it could also be a sign of heart failure, and therefore you need your doctor to take a look and make the appropriate clinical decisions for you. It's also recommended to take the extended release tablets on an empty stomach, either 1 hour before a meal or 2 hours after a meal. Like all other blood pressure medications, avoid abrupt discontinuation of nifedipine. All in all, nifedipine is very effective at reducing blood pressure as well as taking care of angina if you can tolerate it. Do well to discuss all side effects or any unusual things that happen while you take nifedipine with your doctor so that they can make the best clinical decisions for you and not to discontinue abruptly. Thank you so much for staying through. I hope you found some value in this video. Please do well to subscribe to the channel for more videos like this if you have not already done so. Thank you so much, and I'll see you on the next video.